My name is Jonathan Yerasimides. I'm a board-certified orthopedic surgeon. My specialty is primary and revision hip replacement. The benefits of an outpatient surgery are that you get to go home, plain and simple. There's not a requirement to stay in the hospital after a joint replacement. There's nothing spending the night in the hospital is going to accomplish for the vast majority of patients. The spiel that 15 years ago I used to give people about spending the night in the hospital was because that's what everybody did at the time. And times have changed, everything's evolved, and now we realize spending the night in the hospital, unless you have some severe medical condition that really needs close monitoring, doesn't benefit you any. And so I know personally, I'd rather sleep in my own bed at night than I would in a hospital bed. And it's perfectly safe. There's no danger to you or your health in going home. And you get to have a surgery in an outpatient facility versus the hospital, which for your insurance companies is more cost effective, which for you is easier and faster. And then you get the convenience of sitting on your own couch and watching TV that night.